Welcome to Bay Area Health Insurance. Gary Church is here to provide you with expert answers and insights on all things insurance. Call Gary today at 1-408-903-4624 and find the right insurance for you.
So what I find with health insurance, the only thing health insurance does, it guarantees individual and families that they're not going to walk out of the hospital with a $100,000 medical bill.
Yes.
That's all that health insurance does. The problem with health insurance is the cost of health care, right? And it continues to go up every year. The one thing that's interesting is going to happen in 2025 is the subsidies that most individuals are receiving that assist them in the cost of health insurance premiums is the government's subsidizing people's health insurance based on their income. 2025, that goes away. Now, what happens in 2025? There's an election, right?
Yeah. Oh, yeah.
So depending on who gets into office, because our healthcare system is a political pawn,
Yes.
right, between two parties,
Yeah.
Democrats and Republicans. The problem is what's going to happen after 2025? Well, the state of California has already implemented a bill that's called SB 770, which would make California a single-payer health care provider. That means the state would run our health care
Okay.
for the state. The concern I have with that, now you have a government agency that's running our health care.
Yeah.
The problem with that is what kind of level of care do you think we're going to get,
Yeah.
right? So what I do see that's going to happen with our healthcare system is we're going to go to a two-tier healthcare system. Private insurance companies like United Healthcare, Cigna, and the rest of them will go back to doing what they did prior to 2010. So if you wanted to buy a health insurance plan, you can,
Yeah.
as long as you qualify underwriting.
Yeah.
The problem with underwriting is if you have any pre-existing health conditions, you'll be declined.
Oh.
And the insurance companies will be able to state that. Why? Because when it comes to the government running the health plan, so the state of California running the health plan, they'll be able to stay on the government health plan. As long as you don't have any health issues, you'll qualify for a private health plan, which you're going to get much better care through a private health insurance plan versus the state.
Right.
So where supplemental insurance comes in, supplemental insurance set up as a benefit.
Okay.
Right? If we think about it, when do we really actually use the healthcare system?
When we're sick.
When we're sick. Now, not when you got the flu and you go
Correct.
to the emergency room.
Yeah.
Right? It's when you go in and are diagnosed with cancer.
Cancer.
I always say there's three things that happen to somebody that's diagnosed with cancer. The first thing is very emotional. No matter who we are, the fact of knowing that you've been diagnosed with cancer, whether that's breast cancer or cancer, whatever type of cancer, getting that diagnosis changes everything.
Yeah.
That's the first part. Second part of it is the physical aspect. You're going to be going through treatment, whether it's chemotherapy or what other treatment. How much do you think your health plan is actually going to be paying for most of that care? Because there are certain things that are not
Covered.
covered under your health plan.
Oh.
But the other problem is the financial cost. If you're married and let's say your spouse works, both of you work. Now, if you're going through chemotherapy, most likely you're probably not working.
Okay.
Your spouse is going to be taking you back and forth for treatment. If your spouse is taking back and forth for treatment, is your spouse working? If your spouse is not working, where's the income come from?
Yeah.
Well, what supplemental insurance does provides money directly to you when you do have a life-changing event, whether you're diagnosed with cancer, provides money. So when I talk about the three things, one is the emotional, the physical aspect, the financial cost of having a supplemental policy that pays cash upon diagnosis, change the financial side of it.
So it pays you the cash, not the hospital, and we.
Correct.
Okay.
Correct.
Okay.
So what the supplemental insurance is set up for is to be a benefit.
Okay.
Health insurance is a necessity because we know if we don't have health insurance what the financial cost is. So what supplemental insurance is designed for is to provide money directly to that family or individual to provide money for them to use for whatever purpose they want. If you got diagnosed with cancer and you got a check for $50,000 or $100,000, the physical and the emotional part of it's still going to be there, but the financial cost is not, right? Because you have money to be able to continue paying your bills. The biggest problem that people have when they have a life-change event is their ability to work. If they can't work, the first thing they're going to do is they're going to lose their health insurance, or their income.
Right.
What's the second thing they're going to lose? They're going to lose your health insurance.
That's right.
Because the employer's not going to continue to pay it.
Yeah.
Right? And that's the thing that people don't realize. We have insurance for everything. The only thing we never insure is oneself. The most important asset we have is oneself.
Yeah.
If oneself can't take care of oneself, who's going to take care of that oneself?
Right.
Right? Financial costs can be devastating for somebody that doesn't have the financial means. A moment in time can change somebody's life forever.
Yeah.
Right?
Yeah.
So my purpose is to help people understand what their options are.